Hi, my name is Elana Buch, and I am an associate professor of anthropology here at the University of Iowa, and I teach regularly in the Aging and Longevity Studies program. I am delighted and honored to be a part of this celebration of our program. I study how families, communities, and societies are changing as we face the challenges of aging populations. I'm especially interested in the new kinds of relationships and forms of care developing as our societies age, but also in the ways that such relationships are entangled with persistent social and health inequalities. As I mentioned a minute ago, I am a sociocultural and medical anthropologist. A lot of the time, when people find out that I'm an anthropologist who studies aging in the United States, they're a little confused, wondering what someone who digs up bones or studies the lifeways of distant people might have to say about our own experiences of growing older. It turns out that sociocultural anthropology, that's the subfield of anthropology that studies the social relationships and cultural understandings of living people, and the ways that these things are connected to the broader social, political, and economic contexts, is quite useful for helping us see our own take it for granted ways of thinking and living in new light. So that's the kind of anthropologist that I am. One of the ways that anthropologists are able to shed new light on things that we take for granted in our everyday lives is by comparing how diverse people around the world and across history make meaning of particular practices and concepts. Sociocultural anthropologists spend years living among the people we write about, coming to understand their complex ways of life in a fine-grained way. This means we are able to understand how people respond to big historical changes and the everyday plot twists that shape all of our lives. And we can see how long-standing ways of thinking about who and what matters and about how to live a good life shape how people respond to changes big and small. I ask these kinds of questions around topics at the intersections of aging, caregiving, and inequality in the contemporary Midwestern United States. Today, I'll be talking about my research on relationships between paid home care workers and older adults living in metropolitan Chicago. In this talk, I argue that in a nation obsessed with independence, inequality is the secret to some of us staying alive. I share the stories of older adults and workers in Chicago's home care industry whom I met through 2 years of in-depth anthropological research. As shown by the statistics on this slide, home care is one of the fastest growing occupations in the United States. It is also one of the most poorly paid. The gendered, racial, and economic inequalities that structure the home care industry are justified by long-standing preoccupations with independence. In this talk, I show how these inequalities ultimately render home care relationships and the entire industry precarious, and offer ideas for building a sustainable care economy built on the principle of equitable interdependence. Home care workers enable frail and disabled adults to continue living in private homes and apartments by assisting with what gerontologists call activities of daily living and instrumental activities of daily living. These are the everyday things that people need to do to live. They are things like bathing, toileting, feeding, cooking, cleaning, and grocery shopping. For my research, I spent 2 years deeply immersed in the daily lives of older adults and home care workers in Chicago, as well as with the administrators and supervisors of two Chicago area home care agencies. One of these agencies, which I call Bell Tower, was privately funded by clients, and the other agency, which I call Plusmore, had a contract to provide publicly funded home care to qualifying older adults. During fieldwork, I spent 2 months at each agency's offices, observing supervisors' daily work, fielding phone calls, managing workers, staffing cases, and mediating disputes. In the process, I learned about hundreds of older adults beyond those I was able to observe directly. Afterwards, I spent 6 to 8 months visiting a smaller number of older adults on a weekly or bi-weekly basis while their home care workers were present, and I conducted formal life history interviews with these workers and older adults. In the decades since I conducted this fieldwork, I've continued to spend time talking with home care workers and older adults and agency administrators who assure me that while there have been some changes to home care regulations and policies, my observations about home care relationships remain valid. The key idea I want to raise some questions about in this talk is the idea of independence. At first, it might seem pretty strange to be asking, what is independence? Since it's an idea that seems pretty self-evident. Yet for anthropologists, the cultural ideas that are the most invisible and the most taken for granted are often the most interesting. As I mentioned a minute ago, despite systemic underfunding, home care is one of the fastest growing occupations in the United States, and that's in part because of how highly we value independence. Many American older adults desire home care because living in a private residence, rather than an institution like a nursing home, is one of the most important cultural markers of independence. Over the years I worked with home care workers and older adults, it became quite clear to me that our American cultural emphasis on independence played a crucial role in shaping what people understood to be a good old age. Because of this, ideas of independence shape what people expect from home care, what home care workers and older adults did every day. That focus on independence also had a range of consequences for people's lives that I didn't really expect. Most surprising to me was that some of the things home care workers did to help their clients feel independent were deepening the inequalities that already structure the home care industry. I also realized that people meant a range of different, though related things when they talked about independence. And some of the less obvious ways that people talked about being independent point the way towards imagining a good old age that push against, rather than exacerbating, structural inequality. So, when I say that Americans are fixated on independence, what I mean is that the cultural trope of independence shapes a whole range of moral discourses in the United States. It shapes our discussions of what a person is and what people ought to be, how we should relate to one another, how and with whom and in what ways we should live, what we owe one another, and what it means to live in a democracy together. Cultural tropes of independence profoundly shape our debates about what government is and should be, and about what role the government should play in people's lives and livelihoods. And perhaps most profoundly, notions of independence shape our own internal senses of well-being, in that our desires to be independent and our abilities to manifest those desires in daily life are a significant source of aspiration, pride, and frustration at every age. Despite Americans' emphasis on independent living, people of every age and ability profoundly rely on others. Humans are perhaps the most social and the most socially interdependent species on the planet. We rely on other beings, both human and non-human, in every aspect of life, from those activities necessary to our survival, like the growing and processing of food, to those that form the foundation of our ways of life, like road maintenance or the production of energy. Older adults' independence comes into question not because they are more reliant on others, but because debility makes our interdependence more visible. Indeed, in the United States, concerns about independence have more to do with the ways that forms of reliance on others might impede individuals' abilities to make decisions for themselves than they do about the fact that we all, at every age, desperately need one another. So, while we often speak about the goal of supporting the abilities of older adults to age independently and the importance of independent living in later life, it turns out that what we mean by independence isn't as straightforward as we think. Anthropology is helpful for enabling us to understand what it is that older adults are actually looking for when they say they want to remain independent. It is also useful for helping us better understand the social dynamics that make being independent in this way possible. And as I found during my time in Chicago, some of these dynamics rely a great deal on inequality. For older adults to be recognized and recognize themselves as independent persons, they emphasized to me how important it was to be able to live in a familiar manner that reflected what they wanted. When I asked the older adults who participated in my study what it meant to take good care of someone, or how they distinguished good care from bad, they repeatedly told me that there was no one measure, attitude, or practice that defined good care, but rather that good care would reflect their preferences. As Hattie Washington, an 82-year-old plus more client, told me, it's according to who you're taking care of and according to what they want. Elders were unwilling to define or label specific practices good care because for them, good care was care in which they were treated like a person, because it recognized their unique histories, personalities, and sensibilities. As Maureen Murphy, a 72-year-old bell tower client, told me, if I have my senses at all, I'd like to be treated as though I have some. I'd like to be treated like a person, not a piece of furniture. Ms. Murphy poignantly argued that being treated like a person requires those who cared for her to engage her as active and engaged, not a piece of furniture to be plumped and prodded but never asked for an opinion. One of the main challenges the older adults I knew in Chicago experienced was figuring out how to continue to be seen and to see themselves as independent, even as they relied on home care workers to be able to continue to live, quote, on their own. Home care simultaneously threatens and sustains older adults' senses of independence. There are two key ways that older adults and home care workers in Chicago navigated this tension. The first is that home care workers use subtle, bodily forms of empathy to imagine, anticipate, and sustain older adults' everyday tastes and preferences so that older adults did not have to continually announce their needs. This enabled older adults to minimize their experiences of relying on their home care worker, but it also obscured significant portions of their home care workers' labor and value. The second is that older adults strove to form equitable, reciprocal relationships with home care workers so that they felt a kind of balanced interdependence rather than threatening reliance. This strategy took several forms, but it also creates a number of risks for both home care workers and older adults. As I mentioned a moment ago, one of the things that older adults wanted for older adults to be recognized by both themselves and others as independent persons, they not only had to continue to live in a familiar manner, they also wanted to appear self-sufficient, even while relying on others. Workers, older adults, and sometimes agency personnel engaged in a number of practices that then concealed the traces of workers' labor. Some of these techniques work to hide home care workers' labor in plain sight, while other practices worked a kind of social alchemy, making home care workers appear as companions or traditional domestic servants. When done with great skill and tact, workers attuned care, as I described a minute ago, helped accomplish this double move because it enabled workers to sustain their client's life without requiring ongoing instructions from older adults. For older adults, constantly describing each detail of how they like their home kept or their meals cooked meant announcing their lack of self-sufficiency over and over. Much like Mrs. Silverman, every older adult that I interviewed told me that one crucial component of good care was that the worker just knew what needed to be done in their home. For example, Samson George, a 78-year-old plus more client, told me that he particularly appreciated that his home care worker, Kim Little, managed to keep his home tidy without constant instruction because someone who comes is just super, because you get to talk to someone, and let them do what is supposed to be done. With Kim, there's nothing I gotta tell her to do. Though what is supposed to be done intimately involved Mr. George, he spoke as though he had no agency or role in care except to get out of the way. Because Kim was able to work without instruction, Mr. George was able to describe her as a friend he could talk to and who helped out around the house, rather than on someone upon whom he depended. Sometimes older adults downplayed their reliance on workers and suggested that they were actually helping their workers by giving them a job. For example, Harriet Cole, an 82-year-old plus more client, argued that despite a recent and debilitating stroke, she didn't really need help from Virginia Jackson, her home care worker. Mrs. Cole suggested that she saw Virginia as a subsidized housekeeper rather than someone who was enabling her to continue living in her own apartment, telling me that when she was being released from the hospital, she had worked the system to, quote, get everything she could in terms of available social services, though she didn't really think she needed the help. She told me, you gotta maintain a sense of independence. I definitely take my shower. I make up my own bed and get everything together. I said to Virginia, I don't leave things around but just because you're coming here. You only come 2 days a week. These things I'm going to do whether you come or not. I said, don't think that's why I want you here. You're not doing that much. Workers were committed to sustaining their elderly clients' bodily well being and personhood, and generally accepted that they would work in challenging, uncomfortable, and sometimes unhealthy households. This produced notable asymmetry between workers' care for their clients' well being and their care for their own well being, intensifying the inequalities already existing between workers and their clients. Care workers frequently told me about the challenges of working in elders' homes, which were often kept unventilated and hot even in summer months, since so many older adults are easily chilled. Recognizing that older adults might get sick from being in cooler spaces, workers managed their discomfort by wearing lightweight clothing and carrying large bottles of ice water. Care workers subjected their bodies to their clients' ways of life while limiting their clients' exposure to their own worlds and lives. Agencies exhorted workers to bathe every day, never wear unwashed clothes, and carry deodorant so clients would not have to smell body odors that might accumulate. Live-in workers were advised not to cook or bring ethnic food that might leave strange odors in clients' homes. These might seem like common sense practices to many of us. If someone is working in our homes, we expect them to remain our homes, reflecting our tastes and habits and preferences. The value of having someone work in our homes is that they are not an equal participant in the household who imposes their preferences and tastes on ours, but rather someone who helps us make our homes ours. Both through actions that made home care workers' contributions to their clients' lives harder to see and through language that downplayed these contributions, older adults and home care workers hid the ways in which they were interdependent on one another. By doing this, they made older adults feel and appear self sufficient and independent. These practices also normalize and thus perpetuate the inequalities that structure the home care industry. They downplay and make invisible the substantial skill and subtlety that many home care workers used in their jobs. This reinforces common misperceptions that home care work is low skill labor that almost anyone could do. These misperceptions are in turn sometimes used to justify the low wages and lack of benefits common in this industry. In the process of bolstering older adults' independence, these kinds of practices unintentionally undermine home care workers' abilities to be seen and compensated as the hardworking and highly skilled professionals that so many of them are. rather than take for granted that this kind of bodily asymmetry is a natural part of relationships between home care workers and those for whom they care. It is important to attend to the ways that these asymmetries are connected to understandings that independence requires self-sufficiency, that intensify the social and economic inequalities structuring paid care work. As I described earlier, home care workers are overwhelmingly women of color and immigrant women earning poverty level wages. It's worth noting that the concentration of women of color and immigrant women in this industry is in no way coincidental, but rather a legacy of racially motivated laws and policies stemming back to slavery, when enslaved Black women were held responsible for caring for both the oldest and youngest members of slaveholder families. During the Great Depression, the Works Progress Administration developed the first federally funded caregiver jobs through a program called the Housekeeping Service, which employed aides to care for children and people with chronic illnesses. Housekeeping service jobs were meant to provide WPA incomes to families without male breadwinners. However, the WPA paid white single mothers to care for their children. As a result, 4 out of 5 housekeeping jobs went to Black mothers. This policy officially devalued the work that Black, but not white women did to sustain their families, and it subsidized racial discrimination. Another New Deal policy, the Fair Labor Standards Act, also re-inscribed racial hierarchies in the way it considered Black women's labor. The FLSA is the law that sets labor standards like minimum wage and overtime rules. In a legislative compromise, the original FLSA legislation excluded both agricultural and domestic workers from its protections, both occupations in which Black Americans were vastly overrepresented. The exclusion had long-lasting consequences, including for the home care industry. While domestic workers increasingly gained FLSA protection throughout the 20th century, it continued to exclude people who worked as companions to older adults until just a few years ago, when concerted organizing by home care workers and their allies finally overturned it. Given this history and the legacy of low wages that continue to plague this industry, you won't be surprised to learn that turnover rates among home care workers are endemically high, with estimates ranging from 40 to 80% annually, with damaging consequences for home care quality. As the industry grows rapidly, there are perpetual worker shortages. Both worker turnover and shortages seriously threaten older adults' abilities to receive high quality care and to age as they would like to at home. While labor policies pushed Black and immigrant women into domestic work like home care, other policies have worked to keep elder care underfunded and home care jobs underpaid. Policies like Medicaid and the Americans with Disabilities Act have expanded access to home care for low-income Americans, but have also kept wages for these jobs low. Notably, the key pieces of legislation expanding federal and state funding for home care link together the importance of supporting older adults' independence and the goal of reducing government costs for caring for older adults. For example, in Illinois, where I did my fieldwork, the 1979 legislation originally authorizing state-funded home care describes the program as, quote, aimed at assisting seniors to maintain their independence and providing cost-effective alternatives to nursing home placement. As the population of older adults has grown in the decades since these laws were passed, the twin goals of supporting elders' independence and reducing the cost of elder care have only become more urgent for state and national policymakers. While Medicaid programs are the largest funder of home care job, Medicaid policy focuses on ensuring that home care remains less expensive than nursing home care, in part by keeping home care workers' wages low. Other policies aimed at supporting Americans' independence have, not coincidentally, also contributed to the growth of low-wage home care jobs. In particular, the 1996 Welfare Reform Law, officially called the Personal Responsibility and Work Opportunity Reconciliation Act, or PRORA for short, has pushed poor women into low-wage jobs that provide little opportunity for career advancement. Prior to 1996, federal anti-poverty programs recognized raising children as a valuable activity and provided public funds to enable single mothers to do this important work without seeking other employment. In the racializing rhetoric that spurred welfare reform, notions of dependence and independence played a key role, since it was argued that these benefits were making these mothers inappropriately dependent on the government. ProRes states that one of its key purposes is to, quote, end the dependence of needy parents on government benefits by promoting job preparation, work, and marriage. In addition to mandating job training and temporary assistance to welfare recipients, welfare reform created tax incentives for employers who hire people trying to get off welfare. Home care agencies widely participate in these programs. Welfare reform increased the pool of low-wage employees available to employers. However, it is not so clear that it improved the lives of poor women or eliminated their reliance on government programs. Because of the low wages and lack of benefits paid to home care workers, for example, more than half continue to receive some kind of government benefit. As noted on the earlier slide, approximately 1 in 3 home care workers relies on food assistance, and a similar number of workers rely on Medicaid for health care coverage. Note that that data is from prior to the current pandemic. As I demonstrated earlier in this talk, home care workers are charged with maintaining the independence of the older adults for whom they care. However, they, along with other members of the working poor, are regularly painted as dependent, lazy, and undeserving because their jobs leave them reliant on these public supports. So, as you can see, ideals of independence have played a significant role in creating and expanding the home care industry, yet they are also connected to the reasons that home care remains so underfunded. Commonly, efforts to promote independence in later life implicitly prioritize the well-being of vulnerable older adults over the well-being of their also vulnerable care workers, strengthening existing gendered, racial, and economic inequalities. We see these hierarchies of independence in debates over policies that would increase home care workers' wages, benefits, sick leave, and other labor protections. For example, in recent debates about extending FLMA protections to care workers, opponents argued that increasing workers' wages would threaten the affordability of home care services and older adults' ability to live independently. Such arguments rely on naturalized hierarchies between people, in which sustaining elders' independence is seen as more important than workers' abilities to sustain their lives and families. The bodily hierarchies that I described earlier as playing a role in enabling older adults to feel independent are thus reinforced by long legacies of social policy that prioritize older adults' independence over the livelihoods of the women of color who most frequently perform this labor. Yet, as my research in Chicago showed, home care clients' well-being is deeply intertwined with the well-being of the people who care for them. For example, without paid sick leave, home care workers were regularly forced to choose between staying home when they were ill and thereby protecting their clients from contracting their illness, or going to work sick and being able to pay their rent and feed their children. The instability in workers' lives created by their low incomes and lack of benefits inevitably affected their ability to focus on and care for their clients. Independence made possible by social inequality is a fragile and dangerous form of independence. Maria Aureliano, the bell tower worker I described giving Mrs. Silverman a bath a few moments ago, felt acutely the irony of sustaining others' independence while her own life remained precarious. Raised by her grandmother in Puerto Rico, Maria was sent to live with her mother in Chicago as an adolescent and ran away with her boyfriend as a young teen. 3 years later, divorced from their alcoholic father and still in her, 3 children later, divorced from their alcoholic father and still in her early 20s, Maria learned about home care jobs while sitting in the waiting room at the public aid office. She started as a home care worker soon after. About 40 minutes into an interview with her, Maria returned to her role as my mentor in care and in life, telling me how she managed to care for others and survive amidst her pain and struggle. As she was telling me about the early days when her kids were little, she said, "I don't know how we managed, but I always had food to feed my children. Always. It didn't matter if I was inventing. Take a few hot dogs, some salad. You literally had supper. Some people would say, 'You have nothing to eat.' I would say, 'Yes, we do.' There were there were a few things that would hurt. My children would say, 'Is there any more?' And I would be eating. I would say, 'Oh no, but I am full. Here.'" Telling me this, she shook her head, remembering the hunger. Maria narrated this memory as another lesson in caregiving, describing how she made it through tough days. She told me, "I try not to let it show with my patients. If you live long enough, you deserve so much. As a caregiver, you are so happy you show everyone such a good time that nobody even noticed where you lack. I strongly believe you can be crying your head off, but as soon as you walk out the door, wash your eyes, put a smile on your face. My problem is not yours. Don't ever forget that." Maria's smile was a professional mask, shielding her frail and vulnerable elderly clients from sharing in her suffering. She understood that it was part of her job to set aside her own needs and preferences in order to sustain the lives of others, that this hierarchy was a crucial part of how she sustained her clients' independence and well-being. Maria acknowledged that American ideologies of independence held her alone responsible for her circumstances, even though many of her struggles were directly connected to the low wages, long hours, and unpredictable schedules that created the conditions in which she cared for others. In our interview, Maria spoke of teaching her kids the strength you have to have, because everybody can feel sorry for you, but nobody is going to hold your hand. Everybody loves you and cares for you, but nobody wants to hear you say, "I am $100 short for my phone bill." But that same person will invite you out to eat and spend $200 on your dinner tomorrow. But would he give you that $100? No. Because even though everybody will feel sorry for you, nobody really cares. And that's the secret of staying alive in America. It was a damning statement, even more so from this woman, this mentor of mine who had spent her entire adult life caring for people in every direction, her children, her husband, her elderly clients. How to reconcile Maria's profound commitment to caring for others and her indictment that nobody really cares. I interpret Maria as commenting on the way her life was shaped by flows of empathy and concern that mostly ran in one direction. In Maria's experience, those for whom she cared at work were more concerned with the ways her emotions affected them than they were with her actual well-being. For Maria, a woman deeply committed to caring, survival demanded accommodating society's fundamental indifference. The secret to staying alive in America, for Maria, was never forgetting that society expected her and workers like her to be materially self-sufficient. No one would offer to pay her bills, no matter how much they enjoyed spending time with her. No matter that her same skillful companionship in the context of her work in home care was so poorly compensated that it rendered her life and the life of her family perpetually precarious. Care workers enable their clients and employers to be seen as independent and make it possible for higher paid workers to sustain their household and families. Nevertheless, public discourse in the United States represents low-wage workers like care workers as parasitic, dependent on public largesse, rather than as crucial contributors to individual and national well-being. This is true, for example, in new immigration rules that bar individuals from households that receive public benefits from becoming American citizens, even if, for example, they spend long hours caring for American elders. The irony of being seen this way was not lost on Maria, who underscored how odd it was that so many could rely on her caring labor and still think of her as problematically dependent because of her economic status. Maria's perspective reflects both her experience and the broader indifference of our society to those who do the everyday work of caring for older adults, and makes visible the consequences of ideologies of independence that focus on a person's self-sufficiency. Most of the time when I tell my tales, taking our cues then from this more complex understanding of independence as equitable interdependence, perhaps offers us a way to think about how to create more sustainable and equitable forms of elder care. First, we can make visible the ways that we all, at every age, depend on one another. By acknowledging our interdependence in every walk and age of life, we start to notice that while the interdependencies of later life are perhaps more intimate or immediate, they are not wholly different from the ways that humans at every age and in every condition rely upon one another. Broader cultural recognition and celebration of interdependence makes possible several things. It makes it possible for older adults and care workers to work together without simultaneously erasing the traces of workers' contributions. But even more, it makes possible for us to begin broader conversations about how to build a society and an economy in which the everyday labor of making and sustaining each other's lives isn't seen as a burden, but as the beating heart of life. Home care workers are the backbone of our country's rapidly expanding but deeply fragmented elder care system. What happens to them happens to all of us. In the current moment, the vulnerability of paid care workers and the potentially dire consequences of the way they are treated could not be more stark. Home care workers without paid sick leave risk being unable to pay their rent or feed their children when they are ill. So second, professionals working in gerontology and geriatrics can make a concerted effort to recognize the ways that outcomes for older adults are tied to outcomes for care workers. Design program evaluations and assessment that address the interdependence of these populations and refrain from advocating in ways that falsely pit the well-being of older adults against the well-being of those who care for them. So third, we can advocate and agitate for increased funding for paid care, and especially for changing Medicaid and Medicare rules to require that home care workers are paid a living wage, have access to high quality health care, and have adequate amounts of paid sick and family leave. Fourth, recognizing the vital role these workers play in older adults' lives and in our shared well-being means advocating for the communities from which home care workers come. We can speak against both rhetoric and policies that harm care workers or penalize them for their economic straits. For example, as I mentioned, more than half of all home care workers live in households that receive public benefits, which is a direct consequence of the poor compensation these workers receive for their vital labor. And nearly a third of home care workers are immigrants. We can advocate against the recent rule changes to naturalization policies that say that if an immigrant has or is likely to receive public benefits, they may not be eligible to become citizens. Without policies that enable home care workers to earn a living wage, this rule threatens to destabilize the entire home care workforce. In the midst of growing economic inequality, efforts to organize and advocate for domestic workers, including home care workers, have gained strength. These organizations raise the visibility of direct care work, arguing for the essential value of this labor. The National Domestic Workers Alliance, founded in 2007, has successfully organized domestic workers across occupational categories to lobby for legislation like Domestic Workers' Bills of Rights, which extends state labor protections to domestic and home care workers. Their affiliate, Caring Across Generations, organizes families, caregivers, and people with disabilities and aging Americans to develop innovative policies and advocate for policy change and shift the culture around caregiving. I urge you to check them out and support their urgent and important work. All of these measures were urgently necessary before the emergence of the novel coronavirus. The current pandemic has made lethally obvious the many limitations of our current systems of elder care. While much of the conversation has been focused on how to protect older adults from the devastating and age-related effects of COVID-19, the costs borne by paid care workers have received less attention. While nursing home staff have worked tirelessly to protect their residents, the pandemic is also likely to increase demand for home and community-based services like home care. Across the country, home care providers are reporting limited access to adequate personal protection equipment, limited access to socially distant transportation, and continued economic struggles and struggles to find care for their children while they provide care for homebound older adults. Thanks to the inequalities of care prior to the pandemic, home care workers are more likely to live in crowded households with multiple low-wage essential workers. Many home care workers live in communities that have been hard hit by COVID-19 and worry equally about protecting their clients and their kin. These conditions compound the risks of infection for both home care workers and older adults. In many places, home care workers continue to support their clients without paid sick leave, health insurance, or hazard pay. We must advocate for state and federal funding, for safety equipment, hazard pay, sick leave, childcare, and health care for these most essential workers. We should also advocate for expansions in Medicaid home and community-based care funding that would immediately raise worker wages and provide support for workers who have been unemployed but will be desperately needed in the wake of the pandemic. At every age of the life course, people profoundly depend on one another. And yet, thanks to American ideologies of independence, the bodily changes that often accompany longevity are seen as especially threatening to independence. To many Americans, including those involved with this country's home care industry, sustaining the continued independence of frail and disabled people seems like a common sense way to imagine and pursue a good life in old age. This goal is inscribed in the authorizing legislation for many public care programs. Keeping older adults at home is assumed to sustain independence, while simultaneously ensuring that elders remain responsible for the costs of their food and shelter. Yet elder care policies and practices that focus primarily on cost reduction and ideologies of independence that valorize self-sufficiency work together to reinforce and intensify the already unsustainable inequalities that shape the home care industry. These practices and policies ultimately harm both home care workers and the older adults who rely on them. The pandemic has lethalized these inequalities. As we work to rebuild an elder care system in the face of this devastating pandemic, I suggest that instead of returning to our single-minded pursuit of independence, we instead seek to build sustainable systems of care built on ideas of equitable interdependence. Thank you so very much for your time and attention. Please feel free to email me at the address on this slide with your questions or comments. And my sincere gratitude to Mercedes Byrne-Klug and the staff of the Aging and Longevity Studies program for organizing this anniversary celebration and for their thoughtful work stewarding the program these many years. Thank you.